All right, so we've got DeAnn Schaefer here, and she's a nurse practitioner, right?
Yep.
So, what is a nurse practitioner? Like your initials are what? Is it MP or
Uh,
FNP, or what does it
I'm,
mean?
I'm trained family nurse practitioner, which is general family medicine, but I've specialized in both emergency medicine and orthopedics.
Okay, so you can keep your eyes here, so that
Oh,
way,
sorry.
don't worry about the
Oh,
camera.
sorry.
It'll be fine. So, you've been a nurse practitioner how long now?
Almost 4 years.
Okay. So prior to that, you did what? Like what's the story? How did
What's
you
the
get to
story?
become a
Okay.
nurse practitioner?
I was a nurse for 20 years before I went back to school. I started out working on med surg, did that for a few years, and then I worked in the ICU. I did that for about 5 years, and then I worked in the ER, did that for about 5 years, give or take. And then I went and did flight medicine, and I worked on that for about 5 years, and then decided to go back to school to be a nurse practitioner. And I went to school for 2 more years, and then here I am.
That sounds like a lot.
It's a lot.
Yeah. That sounds like a lot.
It's a lot.
Yeah.
That sounds like a lot.
It's a lot.
Yeah.
So, all right, so let's segue here. So, if you weren't a nurse practitioner and you didn't have money was no issue, what would you do with your life? Or what would you do for a week? First thing that you would do.
For a week, like I could do
Yeah, you could do
anything
whatever
else.
you want. Money's no issue. You don't
Like-
have to go to work.
I'd become a trainer at your gym.
Yeah.
Yeah.
So if you're gonna suggest a gym, and what would be your favorite gym on the entire planet, what would it be?
Elevate.
Okay.
Okay.
Just to note, she noted Elevate Health as one of the best gyms on the planet.
LLC.
Yeah. So, all right. So since you've been a nurse practitioner then, what's been like the hardest thing? Has there been a time where you've seen somebody and you'd be like, I don't even know what to do?
A lot of times. Yep.
So when that happens, or what's an instance where like, this is the scariest thing I've done, I don't know what to do. How did you?
Well, I don't think anything is scary per se. I think that you have to know your limits and you have to know what you don't know and not think you know it all. And there's always resources for you, right? So I work with doctors, and there's a reason we have doctors around who go to way more schooling than we do and have seen a million things. So admit that you don't know something and don't be afraid to ask that you don't know it. And you might not even remember it. It might come up a couple of times, but just know what you don't know and be humble in asking for help. That's it. And that's how you learn.
So what's one specific instance, without obviously giving any names? Is there one time where you can remember it was like, yeah, this was rough?
I think when I first started in orthopedics, because it's such a specialized area, just knowing the difference between an ACL tear or meniscus injury or just things like that, just learning, really studying and learning why you need to assess things and what each assessment means. There's different injections that I've done, like joint injections. Sticking a needle into a knee or a shoulder was terrifying for me right away, but just seeing it and doing it and getting used to doing it. Yeah, but otherwise nothing is scary. I don't think anything's scary.